Canada and the United States. And I'm very proud to be associated with NAL as well as Healthy Trucker and the great things they do for our industry. Because at the end of the day, if we've got our health, we've got everything. So congratulations to NAL and Andrea is a lead nutritionist and health coach for Healthy Trucker. She educates and motivates drivers and office staff across the industry to improve their health through simple, consistent changes in their diet and exercise routines. She has a bachelor's degree in human nutrition from the University of Guelph. Go Griffins. I have my Griffin tie on. It's actually from the University of Guelph. Was he?
Yeah.
Did he behave?
Well, I didn't know him.
I think I know the answer. She's a bachelor's degree in human nutrition from the University of Guelph and is passionate about wellness and helping others reach their goals. Over the past 4.5 years, she has coached hundreds of drivers and staff to lose thousands of pounds, reduce the need for medication, improve their energy, and regain their health. Please help me in welcoming Andrea Morley.
All right, thank you, Kim. So today I'm going to talk a little bit about driver health and how that affects the prevalence of collisions and how to improve the health of fleets that maybe that you work with or your fleet if you're here as a carrier. So of course, Kim already introduced me, so I don't need to do that. But before I talk about the prevalence of collisions, and how that is related to driver health, I want to talk about the different health issues that drivers typically face. What we see is that they have a high prevalence of obesity and diabetes. That's pretty straightforward. But they actually have twice the prevalence of obesity and diabetes as the general population does. So a truck driver is twice as likely to be overweight, obese, or have diabetes than just somebody out of the general population or the general workforce. Really important to know. We see a lot of instances of cancer and especially lung cancer. We have a lot of smokers in the industry. There are twice as many smokers in the trucking industry as there are in the general population. A lot of musculoskeletal injuries, repetitive strain injuries. We see this as Healthy Trucker works with NAL Insurance. We see a lot of claims coming in for these types of injuries. A lot of sleep apnea cases, which of course, if a driver's not breathing while they're sleeping, not breathing the entire time that they're sleeping, they of course are going to be extremely fatigued while they're driving, and then that puts their safety at risk. We see a lot of high blood pressure, high cholesterol, and then that's forced them to go on medications. Of course, that's something that we want to avoid as much as possible. We see muscle loss and sarcopenia, especially in the older driver population, which we are seeing quite a bit of. And a lot of mental health issues, depression, loneliness, stress, and PTSD. PTSD is for drivers, we see that in drivers that have been involved in a serious catastrophic collision, a collision involving fatalities, but as well in drivers that have come out of the military, right? We know that they face their own PTSD issues from their previous profession. That is also going to affect their ability to drive safely and stay healthy and safe on the road. So when it comes to driver health and the prevalence of collisions, we're seeing that all of those health issues that I just discussed do affect their ability to drive safely, and they affect the prevalence of these collisions. So I went through a whole bunch of studies to kind of determine exactly which health issues are affecting the collisions and how. So we saw in one study that the highest mortality rates amongst long-haul truck drivers is actually in drivers that are under the age of 55. So it's not actually the drivers who are over 55 and are getting ready for retirement that we're seeing mortality in, that we're seeing them pass away, maybe behind the wheel or just at home walking across the street heading to Burger King. Those are not the drivers that we're seeing pass away at an untimely age. It's the drivers that are actually under the age of 55. Now, why might that be? Drivers that are under the age of 55 have grown up more in the past 10, 20, 30, 40 years. And that is actually when our lifestyles have become the most unhealthy. That's when fast food restaurants have really started to boom. That's when packaged food and processed food has really started to take over our diets. The standard American diet, abbreviated as SAD, because it is pretty sad, has really taken over our lives. It's taken over our health, and it's affecting those drivers that are under the age of 55 and that are now becoming the larger proportion of our workforce, of our truck drivers, because of course they're starting to take over for the drivers that are finally retiring. Yet they're the ones that we actually have to worry about when it comes to their health. Next up, another study showed that drivers with a high cardiovascular disease risk have a significantly higher likelihood of a crash. Now, it wasn't able to say exactly what that likelihood was, whether it was 2 times more, 3 times more, but it was a significant difference. And it showed that there was a trend that as their cardiovascular disease risk score increased, the prevalence of crashes increased as well. That's really scary. Next up, one study showed that obese drivers who have a BMI of over 30, so not just overweight, but actually obese drivers, are twice as likely to be involved in a crash in that first 2 years that they are driving. So after that, maybe they do start to improve, if they do get into a crash, as we heard earlier today, that they get retrained, and then they get more collision prevention techniques, and they do start to improve. But in those first 2 years of driving, they are twice as likely to be involved in an accident. And if a driver is overweight, so a BMI of between 25 and 30, they're still 50% more likely than somebody who is a normal, healthy weight to be involved in an accident. Really scary numbers just based on their health. And we know that we're not able to discriminate against them when hiring. Just because you're overweight, that doesn't mean we can't hire you. So we have to figure out how can we actually make these drivers healthier? How can we help them to improve their health in order to make them safer on the road? That's the difficult thing that we are looking at today. Finally, one study showed that drivers that had 3 or more medical conditions, so any of the conditions that I talked about before, things like hypertension, high blood pressure, renal disease, kidney issues, a BMI of over 35, diabetes, cardiovascular disease, and I just want to point out that if a driver is obese, a BMI of over 35, there is a higher likelihood that they are going to have high blood pressure, as well as diabetes. So it's not uncommon to see a driver with these 3 health conditions. Now, if a driver does have 3 or more medical conditions, they have a significantly increased risk of preventable crashes and crashes with injuries, okay? So again, this is all just to let you know that there is a very serious issue when it comes to safety on the road with drivers that are unhealthy. And that's where we come in. That's why we try to improve the health of these drivers. So I don't need to tell you all what is at risk when it comes to these drivers and their health and the likelihood of them getting in a crash, because insurance carriers, you all know exactly what the risk is. Obviously, there's the time and the hassle that it takes to take care of one of these accidents. The customers and the goods itself, the company reputation, the money that's involved to the insurance companies, to the fleets, to the brokers, absolutely everyone involved in these accidents. Some studies show that the average cost per crash in the US when it comes to trucking is over $500,000. And then when a fatality is involved, that's $11.7 million on average. Incredible costs, and very, very much preventable, right? From many different aspects, but I'm speaking specifically from the health aspect. And then of course the mental health of the driver is at stake, because when a driver does get in an accident, whether it's minor or major, their mental health is going to be affected. They're not going to trust themselves to drive in the future. They may have depression and guilt over that. So those are serious issues that are going to come up in the future, and that may cause their health to spiral, and this is just a negative cycle that we need to break and help them improve their health now before something bad happens and before things get worse. So I talk to fleets a lot about how to improve the health of their company. Now I know we have a bit of fleets here, but as well as a lot of insurance providers. We let them know that it takes a lot of time to improve the health of their fleet. It's going to feel at first like nothing is happening, like these strategies that you're implementing aren't doing anything and it's not worth it and you should just forget it and move on. And Go back to something that seems a little bit more of a necessity within your company, because it's easy to put on the back burner. But it's important to stay consistent in order to see those results over time. Make it easy for the drivers to actually participate and want to participate. Make them feel like they're valuable, and that's the reason that you're trying to improve their health, not just because you don't want an overweight truck driver representing your company. It's because you actually care about them and you want to make sure that they can drive for as long as possible and they can get back home to their families. These companies all need a key few drivers to actually set the example and tell the other drivers, you know what, we can actually stay healthy on the road. These are the workouts that we can do. This is what I make in my truck. Those drivers are the stars and they need to be highlighted. So share those stories throughout the company. And then finally, lead by example. We always tell that to fleets, is that they need to have those key people in the office. I see one of them right over here, Kim. People that lead by example and let the drivers know what they can do to get healthier and show that they're participating in these wellness initiatives as well. So how do we go about creating that healthier work environment? Just want to check my time. We want to host healthy drivers meetings, offer wraps and salads versus burgers and chips, clean up the office vending machines, offer fruit and healthier snacks in the drivers' lounges, provide handouts and other education to them, letting them know like what are some great recipes they can make in the truck, letting them know these are healthy foods you can get at these certain truck stops. Offer them meetings with a nutritionist or a health coach of some sort, and then offering different incentives in order to participate in any of these programs, especially ones like smoking cessation. And then we're also talking lately about making these health programs mandatory. So a lot of fleets offer optional health programs that anyone can opt into and try out if they want, but that doesn't always get the highest participation rates because these drivers don't necessarily take their health seriously because they don't see it as an issue. But we need to let them know of these stats and let them know that their health is actually affecting their driving, whether they realize it or not. Let them know that if they are obese, that they are going to be twice as likely to get an accident in their first 2 years of driving. Those things will make them take it seriously because they're not going to want to get in an accident in those first 2 years of driving because that can affect their entire career. So then we talk about offering wellness training during orientation. That's just something that you have to do as part of onboarding. It doesn't mean that you need to be taking down their health stats and asking for confidential information. It just means that it's a little portion of their orientation that they learn about this and that it's part of their career, because it should be part of their career to try and stay healthy on the road, just as they do all of the other aspects of safety on the road. So what I'm encouraging fleets to do right now, and even different insurance companies, is try to implement plans for health over the next couple of years. So fleets, this is a great opportunity to create a wellness program for the year 2019, because this is when budgets are being reviewed. This is when you can go to management and say, you know what, could we have a small budget for wellness? Could we implement something for next year? And hopefully they'll be able to work with you on that and help you set up maybe a wellness committee. Get 3 to 5 people together that are going to keep each other accountable and help you implement these programs, toss around ideas with. Unfortunately, health and wellness is considered a non-essential aspect to pretty much all companies out there. So it's very easy to put this on the back burner, but it does need to be taken seriously because, as we saw with those studies, it is serious. It's affecting every aspect of the trucking industry, and something needs to be done now because those young truck drivers under the age of 55, they're the majority of our trucking population right now. They're the majority of any population. So if we're not taking their health seriously, what are we doing, right? All right, so that's all I have of time, so thank you all. Again, if during the lunch break you want to come over and try our scale, our body composition scale, we bring that around to fleets and different companies to do health breaks with. So I'll be over there if you have any questions or want to try that out.